I'm Mary Lloyd Ireland, and I was honored to be asked to speak at the Houston Society meeting. My talk was on ACL reconstruction and return to play. This is my website, marylloydireland.com. I have nothing to disclose. During this talk, we'll go through trunk and core, how to measure this and what it really means. So we need to go further upstream and look at the trunk. Again, how do we measure this? Running after ACL reconstructions, hip angles can be normal, but there have been reports, including in our lab, of greater ipsilateral trunk lean, as in this study. So trunk side bending angle at early stance showed a greater ipsilateral trunk lean on the ACL side compared to the trunk side, compared to the control side, and this was significant at the p equals 0.02 level. The plank testing, these are normal individuals who were instructed to do a plank, and you can look at this or get numbers as far as distance, but the individual in the middle was the natural way that she did this. So when we said do a plank, she did it this way, and you can see how there is greater lumbar lordosis, much greater distance from the plank to her buttocks. So she also has anterior pelvic rotation. But when she's instructed to do it correctly, that's what she does. So this is something that certainly can be instructed to do correctly, but this was her natural way to do a plank, perhaps because anatomically of her anterior rotated pelvis, or more likely because of her weakness of hip external rotators, abductors, as well as back musculature. So you do it in the most comfortable way you can, unless you're coached to do it in the correct way. And the male on the bottom was just told to do a plank, and this is the way that he did it. So there are different strategies on doing a plank even, and instructions to the patient can get them in a better position as she has. So these are the front plank and the side plank. This is an excellent demonstration of good plank control. And again, this is more of a fatigue test for the trunk. Here's the side plank. This is going to be testing more hip abductors, to some degree the obliques of the trunk. And this can be difficult even for this young orthopedic surgery resident. Trunk control can also be measured with the patient on a ball. She had a right ACL reconstruction, but she doesn't have great control on either side. So the command is to lift one leg up and balance, and you can see here where she doesn't have great balance with her left, shown on the left here, or her right, where she's wobbling around and doesn't have good balance. So this is more of a subjective testing, but they should be able to maintain or get control and not move around like she's doing. So she has poor trunk control measured this way. This is my website, marylloydireland.com. Please visit it. There are presentations such as this one narrated on the website. Also publications, travel, other links. Thank you very much from Lexington, Kentucky, the University of Kentucky Medical Center. These are our references.